Hello, my name is McKenzie, and I'm the Communications Manager at HCGC. If you wouldn't mind introducing yourself, including the name, what agency you work for, and how long you've been working as a CHW.
My name is Kawther Musa. I work Heart of Ohio Family Health Center. Heart of Ohio Family Health Center is a federal qualified health center and we located Franklin County. We have like 5 communities and we are a very growing company. I have been working with this company for almost 3 years now. I am the HIV program coordinator and also a community health worker.
And what inspired you to want to become a community health worker?
What inspired me is I remember I have been working with a community agency for a Somali Community Association, and then I was doing office management and that thing. So people always use it to ask me about how can I, how can I begin paying my electric bills? How can I get housing assistance? How can I get all those things? So I didn't know, like how to get a resource for those people. And I had a conversation with one of Ohio State professors. And he told me about the CHW classes. And he told me like, hey, if you go through this class, you will learn about what resources is available for your community, and you'll be able to connect community to the resources. So he inspired me. He told me about the benefits of the CHW, and like it came from me, but he told me like the way out is to get the CHW certification. Yeah.
Cool. And what's been your favorite part of your job working as a CHW so far?
Working as a CHW, my favorite part is working with my colleagues. They inspire me all the time, and also in terms of job, what inspire me if like whenever I work with somebody in coordinate a case for someone. For example, let's say somebody who was struggling like a rent. Once they get paid their rent and they feel a smile, that what makes me, that's what inspires me, and that what makes me stronger every day.
And what's one thing you wish people understood more about the work that you do?
About the work I do is it's not a job like it's not, for example, it's not a job that like starts from 5. It's not a job that starts from 9 to 5. It's a job that you can do when you are passionate about it, because you will be doing, like, for example, what family and child service does. You are finding somebody like where to sleep, what to eat, what to wear. Like you are coordinating all those things. So it's not something like you do and you live. It's something that I will encourage the future CFW that they should know, like it's something that they should go if they're passionate about to help other people. It's something that I mean follow up all the time. Like when you do something, you don't have to say, for example, I did this today, I'm not gonna do it again. You have to keep doing it. For example, if you send somebody for let's say for finding a Medicaid, like it needs like follow up all the time. For example, if you refer them to Family and Job Service, or if you are the one who's doing the application as SE, you have to do like putting all those documentations, educating the patient or the client what they need, showing them like how this work is, so they should be aware of how this case should end up. For example, it can take more than a day, it can take weeks, it can take a month. So I would like the future CFW to know about it's not something like one time, something that's going on, and yeah.
It's continuous work. And what are some practices that you've either developed or some things that you've carried over into being CHW that are self-care related? How do you take care of yourself after?
Yeah, that's a great question. Like it's very stressful job. I don't mean like a very tough job. I mean like because you are dealing with the problems all the time. So like having good time with my family, talking my free time with my friends, eating healthy food, at least trying to walk, at least if I don't can, and my schedule it's very booked, trying to at least to walk around it and around 15 minutes, something like that. I feel like that's something helps me to keep myself healthy. And, yeah.
Good. And so you've done a lot of work with the COVID-19 pandemic and the vaccines. So how have you worked to combat the misinformation that has been spread?
Yeah, we tried. Our, for example, Heart of a High Family Health Center tried to create videos in Somali language and also English language, and then we tried to educate our patients, and also we used all the true information is fact sheets from Public Health CDC, and we share with our patient to make sure that they have the right information. And also we created a lot of materials. Our marketing department, they created a resource such as flyers and posters to give as a handout and to share other entities as well.
Beautiful. Would you mind telling us a story or two about a client that you've been able to connect to a medical referral for the COVID-19 vaccine, and how that experience was for you?
I had a patient who I introduced the COVID-19 vaccine, and then they were very hesitant at the beginning. And then the good thing is that I had the information, the fact sheet that community health gave it us, and I was telling the client, the patient, what the side effect of the vaccine, and then I was telling them that I was one of the first few people who took the COVID vaccine. I was giving my own experience all the time. So the patient, they refused at the first time. And then again, I called them because, as you remember, we started the COVID vaccine with the people who are 80, those who have complications such as asthma or diabetes, hypertension, those who are high risk people. So I was giving them the same information all the time. So that client, they started to call me after a few times I called them. They started calling me, and I was from the first day to our last call, I was giving them same information. And then they said, we're gonna trust you because they want, and up to date you are giving us same information. And then, at the end of the day, they took the vaccine. So I feel like always educating the patient is or client is to giving them same information may help, they may trust you. So I feel like that was a very successful story. And also, I feel like when patient they had no insurance, they had no ID, and then they were asking like, "Hey, how can I get COVID vaccine if I don't have ID, if I don't have Medicaid? How should I get that? I'm not qualified, and I don't think I can get it." I told them that they are qualified. Vaccine is free for everybody, and we are not charging it. So at the end of the day, they agreed that they will have it, and yeah, they take it. And also, at the beginning of COVID vaccine, I remember people had a lot of negative information. I remember in Somali community, they tell that if you take the vaccine, you are not getting a pregnancy because infertility, and also it's not halal. It's the continent. It's from pork, and so it's also some of people they believe it that COVID vaccine has it's not the real vaccine, it's water, and it's a fake. So there was a lot of things that was not true. But right now I feel like because of the hard work that the community and the health organizations are doing, I feel like people overcome those negative things.
Yeah. And all the work that you do is definitely helping dispel all of the myths. So by connecting people with other resources, do you feel like that has been able to establish more of a connection so that your community is able to trust you with more COVID-related things?
Yes, I feel that has created an opportunity for me to discuss with them, like if they had the vaccine, because I feel like that gives you more time. You should be able to call the patient. You should be able to see, because we are providers. I work at clinic and I'm able to see the patient because of the COVID, but still I was able to see them. So I was able to connect to them also other resources. So creating that trust between me and the patient has given me an opportunity to engage them to get the vaccine, and that was something really very helpful. So calling, giving them the information, creating that friendship, they will trust you and they will say, yes, I'm gonna take it. And also not only that, but also giving like your own experience. Me as a Somali African Muslim woman, when I was taking first, I was hesitant because I didn't know if this is halal or haram, like if it's allowed in terms of religiously. Because and then I said no, you have to take it. I said even the shuyukh or people, religious leaders, they don't know it. So why do I have to wait until they do the research? I'm gonna take and save myself.
Mm-hmm.
So I feel like, and then I created a video, and then showing that video, my patient will bring me more information in Somali language has helped me to, to build it and get that trust between me and the patient. And they were able to say yes, and also me as a counselor, I do work with the Somali community as like a community activist. They know me. They see me a lot of communities and events. They see me like mosque. They see me like a lot of locations. So they trust it because they know me. So I feel like also that like as long as they know this person, they know like this person is not giving them a false information. They know that I'm not gonna create something that will harm my community. So I feel like that's something else that helped me to call them and to educate them about the vaccine.
Yeah, being part of the community that
yeah.
you're also serving.
Yeah.
Beautiful. Well, thank you for being here today.
Thank you so much for having me.